right, so as I mentioned this morning, we're going to be talking a lot about issues of women in medicine as well as women's health care, but with an emphasis on what AMWA's doing in these spheres and what we can do as AMWA members to try to affect change. So our next talk is going to be on sexual harassment. If we could have the first set of slides. So I appreciate all of the responses to the blast email that went out last week to see what members of this organization's experiences were with sexual harassment. A lot of very personal emails, very personal stories, very harrowing stories, but common themes all through the stories and stories that you read elsewhere about sexual harassment. People afraid that if they told about what happened, that it could impact their school. They quote unquote learned to live with it. Some women that have been in practice for a while who would realize now in hindsight what they'd experienced, wish that they would have chosen a different career, which is really sad when you think about all they've been through to be as successful as they were. And I would have to say, when I was a victim of harassment early in my career, I did the same thing. I assumed this is just the way it was. As an orthopedic surgeon, we're 4% of the orthopedic community. I was very excited the first time one of my research papers was accepted for presentation at a national meeting. I was the only female presenter at this meeting. Went to the cocktail reception the night before, and there was another physician there who was intoxicated, who had me cornered against the wall. I left, and he tried to follow me to my room. That would have been great if that was the end of it, except we had to sit on an expert panel together the next morning. So that was challenging, but like everyone else, I didn't say anything because she just learned to accept it. So if we can move on to my slides. They're labeled sexual harassment, shockingly enough. Yes, we loaded this morning. So part of the issue with sexual harassment, as we get the slides loaded, is a definition of sexual harassment. We typically think with the stereotypical sexual harassment that it's inappropriate touching, it's asking for sexual favors, it's assault, it's rape. And although those are forms of sexual harassment, those are the most egregious forms, and fortunately the rarest forms of sexual harassment. But the thing to keep in mind with those is that it has nothing to do with sexual attraction. It has everything to do with power, with coercion, and with attempting to maintain the hierarchy. You see it actually more commonly in women who are in careers that are less likely to have more women in them, so male-dominated careers, so careers like surgery. And actually, the women who are the most likely to be victimized are Caucasian surgeons over the age of 50, which really didn't thrill me so much. If we could, do we have my slides yet? Oh, no. All right. But there are other more subtle forms of sexual harassment. The first that I was mentioning with the physical contact is more sexual coercion, concerning in medicine too because of the power hierarchy. There's the quid pro quo, so there's always a risk that the sexual favors are being asked in return for something. You get a job, you get a better grade, whatever, and unfortunately that still happens. But again, the more common are the non-sexual coercion, but everything else that impacts us on a day-to-day basis, either verbal or nonverbal. So it's the constant comments about women aren't able to do something. It's sexist comments, it's gender bias comments. It's things that we hear consistently as the microaggressions that, although harder to show that they're sexual harassment, really fit into the category of sexual harassment and have the same impact. When you look at sexual harassment, it's not based, it's kind of like pornography, you know it when you see it. Sexual harassment, it's the same way. It's not, you know it when you see it. It's not based on intent, but it's based on perception. And that's how so you know when you've been a victim of sexual harassment. It's anything that makes for a hostile work environment. Because of that, there are then secondary impacts on the victim of sexual harassment. We tend to have more psychosomatic issues. There are more episodes of depression and burnout, GI issues, all of the things that Doris was talking about earlier that are signs of burnout. You get the same thing when you're a victim of sexual harassment, and that can lead to long-term impacts on your career, whether it's because of those either psychiatric or physical signs that you have of harassment, almost looks like PTSD at times, but also the changes that you make to your work environment. If there's someone who is consistently being abusive to you, you tend to avoid them. But if you need to be around them to help your career progress, if you need to be in those social situations or you need to be in those meetings, avoiding that is either not an option, or if you do avoid that person, there's a risk that it's going to have a negative impact on your career. So sexual harassment is an issue, and what's frustrating is when you look at the research on sexual harassment, we're not making a lot of progress. Phyllis Carr did some research in 1995 that looked at the rate of sexual harassment that had been identified among women and men in academia. 70% of women identified that they had been a victim or had somehow perceived sexual harassment. If you look at data 20 years later, the number is like 68%. So we haven't made a lot of change, and there's significant differences between the percentage of women and the percentage of men who state that they're victims of sexual harassment. Interestingly, when you look at, and this is all levels, so this includes medical students, when you look at medical students, the men are actually more likely to report being victims of sexual harassment only in their OBGYN rotation, which I think is interesting. Otherwise, women have higher rates of sexual harassment in all rotations, especially in general surgery. And so how do we define it? So this is gender discrimination or sexual harassment that refers to gender-based behaviors, policies, and actions that adversely affect work by leading to disparate treatment or creation, again, of an intimidating work environment. How do you feel? How do you perceive the action? How do you perceive what is said? And how does it impact your ability to work? The reason I left the font as I did for the reference is you will notice this was published in JAMWA. So as we talked this morning, JAMWA is up and viable. This is why this is important, because this is where things like this can be published. So we talk about the fact that it can be hard to define, can lead to burnout, the power differential, the sexist comments. Where does this occur? Medical school, residency, academic settings, private practice. Interestingly, also at professional meetings. In a study of professional meetings of STEM, so that includes medicine and all the other sciences, 60% of female participants in meetings, in a variety of meetings who were surveyed, stated they'd been victims of sexual harassment at a meeting. Whether it's being cornered in a room, whether it's being groped under a poster, whether it's being asked to come up to someone's room because they want to show you their research. A lot of things that are happening at meeting, and this is unfortunate, but not necessarily always reported. So again, this is the survey from Phyllis Carr in 1995. Reshma Jagsi repeated this. Again, as she did in the study on pay equity, used the same K08 and K23 award recipients that they're clinician scientists. That helps give you a level playing field. And so, again, Carr, 77% of women, 20 years later, 70% of women. So again, we have not made much progress. When you look at medical students, most will observe sexual or gender discrimination or sexual harassment at some point during their training. The question is, does this impact specialty choice and where you choose to do your residency? And there's some indication that it does, which is unfortunate, because if you've gone through your training and you know what you want to go into, and you do a clerkship and you find out you're going to be harassed and you change your career plans, and then what? Then what are you going to go into? This was a longitudinal qualitative study of 12 third-year female medical students to see how their views of these behaviors changed during the course of their clerkships. All expressed inappropriate behavior of some kind from their male supervisors, some meaning residents or staff, but none labeled it as sexual harassment. So again, understanding what sexual harassment is, and it's not just assault and rape, it's the broader perspective of what can impact your career. Interestingly, early on in the interviews, earlier in their third years, participants said that they would be upset by this kind of behavior. By the end of the year, they said they just accepted it. So essentially, they'd been beaten down. When asked how these students felt by the end of their third year, especially regarding sexual harassment and bias, they felt guilt, isolation, powerless, desensitized, resigned, silenced, and just too tired to care. So this is an area where we definitely need to intervene. These students felt ill-equipped on what to do. What do you do when you think you've been a victim of sexual harassment? Because they are concerned that if they do something, if they talk, potentially it could be worse. They're concerned about the power dynamic and concerned about the impact on their careers. Interestingly, some students were warned by the clerkship coordinator at the beginning of the rotation to avoid some of the faculty or be aware what some faculty behavior would be. And this puts the onus on the victim to try to avoid someone with whom you have to work to learn to be able to get the grades that you need. So you shouldn't be telling them to try to avoid them. So again, the focus of part of this meeting is what can we do? Well, there are groups that are doing something with this. The National Academies of Sciences are looking into this. They are studying the impact of sexual harassment in academia, including in medicine. They had their initial meeting in California last May, and Eliza and I were invited to participate in that, and as far as the initial planning. The committee has had a couple of meetings since that time. Their last meeting was this past Tuesday. I was again asked to participate representing AMWA to discuss their findings up to this point. This is a statement of their task, primarily review of the research on the extent to which women in the fields of science, engineering, and medicine are victimized by sexual harassment on college and university campuses, research labs, and hospital and medical centers. So looking at the research and then developing an action plan. One of the things that was interesting during this meeting, discussion of harassment training, so we know harassment happens, what are we going to do about it? Well, unfortunately, some of the knee-jerk response from lots of institutions is to provide harassment training, the vast majority of which is online. Well, what happens with harassment training? It's the usual, you do online training, and do we know that it works? There really is no evidence to show that it decreases the risk of harassment, which is why I, again, this morning got my notification from the VA that I'm 15 months late in doing my sexual harassment training. It's because it doesn't make any difference. But Justine Tinkler has done a variety of studies on the impact of sexual harassment training by giving men and women the implicit bias test or implicit association test in regards to gender, do it before sexual harassment training and afterwards. And what she found is that, as we know, men and women are biased against women just because of what happens in our culture, men to some degree less so. But after sexual harassment training, the bias was worse among both men and women. The thought is that this training, because it's bringing up different types of behaviors, it does increase unconscious biases. The increase in unconscious bias is actually greater in men and women who initially had these biases. The thought is that it just confirmed the views that they already had. But even in egalitarian women, so women who had the least bias against women, training actually increased their bias because the thought was because it made them feel disempowered. So not only does sexual harassment training not work, it may make the situation worse. So when we're looking at how do we address this, sexual harassment training is not it. Reporting would be great. Unfortunately, again, it doesn't happen because there are concerns that nothing's going to be done. The victim didn't feel supported and at worst blamed. It may be thought to be their fault. There's concern that wouldn't be kept confidential, and there may be negative professional and social consequences, or just the process is unclear. What do you do? When do you report to whom, and what does that process look like? So as far as next steps, the National Academies is going to continue to discuss this and develop an action plan. Their next step is to have 8 focus groups around the country. I would stay tuned to information from AMWA because we're probably going to have increased collaboration with them as we move forward so that the voice of AMWA can be heard, especially for the students. So I'd like to introduce our other 2 panelists. First, we have Lisa Lynn Garcia, who's an employment attorney here in San Francisco at Littler Mendelsohn. She's going to talk about what do you do. So again, as an action step, if you think you've been a victim, what are the things that you need to address? And then now Dr. Rebecca Apple, who is the Senior Manager of Programs to the American Medical Student Association and member of AMWA's Cultural Integrity Task Force. So I will turn it over to Lisa.
All right. Hi, everyone. Hi, everyone. Thank you for having me here. So in terms of what I want to discuss today, I kind of want to break it down into a few parts. First, I want to discuss what is considered unlawful harassment. Then let's talk about the conduct of what would constitute as unlawful, and then the actions that you should be thinking about, and then the resources that you may have. So in terms of harassment, there are 2 kinds of harassment. One is something that Kim had already spoken about. It's more of a quid pro quo, where you're being subjected to an offensive conduct where it's a condition, more or less somewhat you feel like it's a condition of your employment. For example, hey, come up to my room, or else I'm going to give you a demotion, something like that. The other is where the conduct is they're somewhat hand in hand. The second one is a hostile work environment, where the conduct is so severe or pervasive that's enough to alter the condition of your employment and create a work environment in which a reasonable person would consider it to be intimidating, hostile, or abusive. So this is a sliding scale, meaning that if a conduct can be so severe that one incident alone creates an abusive working environment versus a conduct that is it's a repeated conduct of that it's a culmination of events that is so pervasive that it creates an unwelcome abusive environment. So when you're looking at conduct, a lot of times the conduct isn't something like, hey, come up to my room. It could be very microaggressions, meaning there could be things that are said. It could be things that are written, such as in emails or text messages that gets exchanged, or it could be something physical. It could be something where someone may have like touched your arm or something, or where they're blocking your path, where they're not even being touched. And in terms of harassing conduct, it doesn't have to come straight from a supervisor. Harassing conduct could come from a colleague, it could come from a patient, it could come from a vendor, or even a visitor at your workplace. And then in terms of the conduct itself, it doesn't have to be sexual either. Sometimes, for example, it could be gender-driven. I know today we're talking about gender harassment. Of course, there's also harassment related to religion or national origin, age, and so forth. But here, gender harassment could involve something that's completely not sexual in nature. For example, a female supervisor may be demanding that their subordinate wear makeup or dress in a certain way, where it's not sexual, but it is driven because you're a female. So in situations like this, where I feel like most of the time in the harassment cases that I deal with, it's never really an aha moment, like, oh, this incident happened and therefore must be sexual harassment, like it finally ticked the box. A lot of times it's a culmination of things that have happened, where the first incident you may be like, I don't really know, I don't want to make a big deal out of it, so I'm just gonna leave it alone. And over time you all of a sudden realize, oh my gosh, my workplace is so horrible, I hate working here. My advice to you is that whenever you feel an incident has made you uncomfortable, you should speak up about it. Because sometimes it may not warrant an actual hostile work environment under the law, but it is still an uncomfortable work environment, and you should speak up. And a lot of times people may not be conscious of what they're doing, and they just, may have made some offhand joke that really is offensive, and they don't know that. So a lot of times a nudge from a supervisor or someone from HR can go a long way with changing the work environment, where you don't have to wait until it's so horrible that, okay, now I'm going to speak up about it. And so in terms of reporting the conduct, I think one of the most important things you want to do is try and be as specific as possible. Comments like, oh, my supervisor has made several comments to me, and it just made me feel uncomfortable in the last few months. It's very hard for somebody to hear that, to really understand what's going on. So I would recommend that, you really, if it's one comment, you're like, I don't really want to report it, at least jot down what the comment was. Jot down the date that it happened, whether who was around to have heard it, and how you reacted. Because when you report the incidences that made you feel uncomfortable, the more detail you can provide, the better, because it really puts the person who's listening to the situation in your shoes to really understand, oh wow, okay, then I could understand what you're saying, versus and understand where you're coming from, versus just oh, he made me feel uncomfortable. What does uncomfortable really mean? And so if you could give as much detail about it, I think it just will go a long way in terms of the employer or the school to understand what's going on, and to identify for the harasser, the wrongdoer, exactly what they did that has caused the discomfort. And in terms of your resources, I would say you could speak to your supervisor. And if you don't feel like your supervisor is somebody who you're comfortable with, you can always go up, skip him or her, and then move on to your next person. Or I think speak to your human resources department. And for if you are a student, the school also has a department where you could speak to. It's not an. It's like a counselor who can give you advice and could step in and help with the situation in terms of that relationship. Because a lot of times HR could speak to the supervisor and not say, hey, so-and-so said that you did X, Y, and Z. It could be, oh, I heard this thing happened. And, if it happened at a meeting or something, who knows who reported it? It may not have, even though you're the person who had been the person who received the comment, a lot of times, though, other people could have reported it, so you could ask to be anonymous. But if you feel like, I spoke to HR, I spoke to the supervisor, and nothing is being done, there are agencies. There is the Equal Employment Opportunity Commission, as well as related state agencies that you could go to who could provide advice to you.
Hello. Hello. Just making sure you're all awake. My name is Rebecca Apple, and I'm not an MD or a DO. My background is bioethics. Kim, I want to thank you for saying that sexual harassment is not about sex. It's about power. It's about someone feeling as though, hey, can I say a bad word? Here's an opportunity to make someone feel like shit, and I'm going to take it. That's what it's about. And as an ethicist, I'm aware of the resources. I can't tell people what resources to go to. That's why we have the attorney. But, law and ethics don't always go hand in hand, so I think that's why I'm here. To talk about the fact that, yes, the guidelines might tell you to go to your supervisor, but what if your supervisor is the one who's making you feel like shit? And what if your supervisor's supervisor is your supervisor's best friend? So it's a tangled web that we have. And since I've started out by talking about power, I'm going to share a personal story. I know I'm really adorable now, but growing up I was really ugly. Okay, let me tell you how ugly. So when I was a baby, my mom put me face down in the carriage when she would take me to the park because her ex-boyfriend used to be there and she didn't want him to see how hairy-faced her baby was. I'm not kidding. This is my mother, okay? So growing up, knowing that, I was not a little cutie pie, it conditioned me to really like compliments because I wouldn't often get them. So then when I became a grown-up in the professional world, it didn't immediately hit me when someone would say something inappropriate. I would take it as a compliment sometimes. Then I got some education, and I did some introspection, and I realized this isn't, don't talk about my butt. What is the matter with you? But what's happened is we always talk about women's butts. How many of you have not seen the pictures of our First Lady practically naked? How many of you not seen those? They're out there. She's all oiled up, and that's our First Lady. That's who represents America. So the younger folks, I want to ask you, would it be hard to find a picture of Britney Spears' vagina online? No. But she's our role models for girls, right? Disney. Didn't she come from Disney? Okay, so this is where it is. Okay, it is power over women, teaching women that this is what you have to offer. I remember what it was like to not be cute. And I know what it did to my psyche. I know what it did to my self-esteem. And I know now what it did to relationships that I had on a professional level. So what I'm here to say from an ethical perspective is your value is not on the outside. Your value is not what can be slathered up in oil. If you want to slather it up in oil, sister, go ahead. But we all make choices. Every day we make choices. But really, use your powers of introspection to really determine where your value is. And for gosh sakes, make sure that every little girl you meet, you tell that to. Think about what we call little girls. Oh, you're so pretty. Oh, you're so cute. But what do we tell little boys? You're so strong. Well, you know, I don't live with any men. If something breaks, I have to fix it. If something falls, I have to pick it up. So somebody please tell me I'm strong. Right? So if you're suffering, if you've been hurt, find someone who can listen to you and let that person navigate waters for you so that you can take care of yourself. If you're not suffering, if you haven't suffered, if you're not hurt, if you haven't been hurt, please take care of the girls behind you. Stop telling girls, do you want to give so-and-so a hug? Let them figure out if they want to give so-and-so a hug. Stop telling girls to smile. Show the girls how to be powerful so that others will not have as many opportunities to take that power away. That's all I got. And I am cute now, by the way.
So, thank you. So I think what we're all trying to reach for is a culture in medicine where there is mutual respect. And so again, we have our Culture of Integrity Task Force. It'll be meeting this evening at 8:30. That's part of what we're addressing with that, is how do we develop this? And again, the National Academies will continue their work. The report is supposed to come out in 2018. They, as I said, are setting up 8 focus groups around the country. AMWA will most likely be hosting one of those. But stay tuned, and I will keep you guys informed on how we're doing, and any input that you would have. If there's more input, please let me know, because we need to have the dialogue. This, unfortunately, is, yes, the data is out there on harassment, but unfortunately, for the most part, this is a dirty little secret that isn't talked about enough, and I think we need to continue the conversation. So thank you.